Daktari Rosa Kisonga nimekuona. I have seen you, Daktari. Which is a good thing. Yeah, you love music?
I do.
That's a good thing.
Yeah.
And I know Elsie on the other side was tapping her foot. Nimekuona. I have seen you. So if you're loving the music, let's join in the conversation. We're talking about the Childhood Cancer Awareness Month, which is this month, right?
Mm-hmm. Well, also, discussing the work that Faraja Cancer Support is doing to help mitigate the effects of childhood cancers. Of course, we asked Dr. Rose a few questions before, but just to know, as a caregiver, as a parent, are there any telltale signs that can be early detectors for cancers in children?
Yes. Cancer symptoms tend to mimic a lot of childhood illnesses. So there'll be fever, there will be weight loss, loss of appetite, child is looking fatigued. In some cases, there's swellings on parts of the body. So, of course, the first thing you think about is the normal childhood illnesses. So you take your child to hospital, have an assessment done. But the thing I want to emphasize is if it's taking a little bit too long to get to what the diagnosis is. If you've been getting treatment and a month is passing, you're not seeing much resolution, your persistent weight loss, the medication that you're being given is not really working, then you need to start thinking outside a bit more broadly. Maybe you need to seek a little bit more specialized help. The healthcare worker as well, if it's not fitting into the category of what is the normal, then now you start looking a little bit outside of what you think the normal things are. So if you've been treating malaria endlessly, if you've been having pneumonia that's not going away, if you're just saying a child is also always tired, always sleepy, all the swellings, there's weight loss, then now you start thinking a bit more broadly.
Okay.
I love what you're saying. And Elsie, I'd like to know, there's the immediate reaction after diagnosis. And now that's how Faraja comes in, and this child has been told maybe they have cancer, or maybe a doctor has been looking at the symptoms and they found out there's chances that the child has cancer. And when they come into Faraja, what's the care like?
I will say the very, very fundamental and immediate intervention when you come into Faraja, first of all, is information, awareness. When you know what you are going through, when you are aware and understand the cancer condition of your child, then of course you're better able to make decisions, very quick decisions, as Dr. is saying, seek for treatment immediately and even adhere to whatever recommendations that the doctor would give, and even for the non-medical support that we give at Faraja. So information and education is very important, and we do that. Secondly, and very importantly, we also provide complementary services. Complementary services are those that will relieve the symptoms, what Dr. Rose is speaking to. When you have a lot of fatigue, nausea, a lot of emotional stress, uncertainty, these services will help the child and also the caregivers, the parents, the family, to be able to relieve those symptoms, to be able to mentally be in a space where they are able to make decisions. They are able to know for certain that this is a journey that we can be able to take. Complementary services are, for example, nutritional counseling, very important. We do massage, we do physiotherapy. We also do a lot of breathing works, a lot of Zumba, and just speaking with the caregivers all the time, so that they are able to know somebody's working with them and this journey is doable and is workable. Thirdly, we provide a lot of social support system in the name of support groups. This is a space where for each specific tumor, your peers are coming together. Caregivers like yourself, a grandmother, a father, a mother, coming together in these safe spaces to speak about what they are going through, taking care of their child with cancer. In these spaces, we also provide medical experts, just like Daktari, to be able to address signs and symptoms, to address side effects of chemo, side effects of radio, what do you do with your child, to be able to address those fundamental questions around activities of daily living that a parent, a caregiver would have for their child. And of course, we support with the finances for medical treatment for the child. So those are the ways that we come in as Faraja to be able to support, and those come in immediately. In fact, way before, because awareness is to all of us as the public around cancer. And then, of course, when you're in that journey, our doors are open to continually connect with you to provide psychosocial support that is just as critical as medical treatment for cancer.
Right. We're about to get into the music, but before that, Dr. Rose, I know that, of course, the survival rates for childhood cancers are a lot better in, for example, Europe and the West than they are here. And a lot of that is because of either early detection or treatment. But are there advancements that are being made that, could improve the odds for cancer diagnosis among children? Yeah.
Of course.
Yeah.
Of course. So over the years, there have been a lot of study, research, a lot of work has been done. If I was to compare, for example, for acute leukemia, in the US, in some places, it's up to 95% cure. In our setting, for example, I'll give an example of Uganda. We were approaching about, it was 30%.
Wow.
And then through the program and active treatment and that number went up to about 50-60% in a resource limited setting.
Yes.
So what that is saying is, even with our limited resources and our challenges, there is hope. And so we can move that number from what it is now, about 50-60%, we can approach 80-90%. Because the protocols that we use are similar. What we use here and what we use out and what is used out there are the same. The difference is in the supportive care.
Okay.
Are we getting enough nutrition? Are we catching some of these diseases on time? Are we adhering to the protocols? Because if you start treatment and then in the middle, our local beliefs sometimes hinder us.
Yes.
And you go in between and you're told, oh no, you need to go and have
ginger and
other additional medication. And
Yeah.
then you get off your medication. By the time you're coming back, then you have changed your outlook. So we're not saying that those that have no role. We're saying we do them concomitantly. And that shifts the numbers. For children, the outcomes are so good. Usually the problem is you come in a little bit late, so we're running to catch up, or we are not sticking to the protocols, or the supportive treatment around it is lacking. And that's why places like Faraja are important, because for a lot of people, yes, you can come in, you want to get your treatment, but if you don't have food on your table, if you can't afford to come in for your treatment, then that affects the outcomes. So there's lots of hope. There's a lot of hope in childhood cancer.
We're getting back into the music now with DJ Nara. We'll take a look at the traffic and then come back to wrap up this conversation with Dr. Rose and Elsie Mulindi of Faraja Cancer Support Trust.